So I saw orthopedic last year, they wanted to do surgery on my ankles and shave the heel 30 degrees and reposition it. I don't want to do that.
Sounds a little like.
So then I went to Corey Westner, who said, well, wear your insoles all the time, wear your shoes all the time unless you're showering or sleeping.
Okay.
I don't like doing that either.
Got it. I see you have some very firm orthotics.
Yes.
These are
Yeah, they don't bend.
Those are the 22 caliber. Those look familiar. So very firm insoles, right?
Yeah.
Okay. And then tell me what your symptoms are like.
I get a lot of pain on the top of the foot here,
Uh-huh.
and there's pain in the ankles, on both ankles. This one's worse.
Got it.
So when I walk, if I bend more than that, it hurts.
Okay, so right now that's bothersome.
Yeah.
Okay. So bring your feet even and see what it's like for you to go into a mini squat. Is that bothersome for the ankle?
Yeah.
Okay. All right. So fair enough. Everybody see how much you can move? Great. If you don't mind, have a seat, take off your socks, and also fold your pant legs up like 4 or 5 levels, like Huck Finn. Yeah. There you go.
Got my
Perfect.
compression hose on.
Excellent. What's the webinar on tonight?
What?
What's the webinar on tonight, if I can ask?
Well, it's Cheeselandia. You ever heard of Cheeselandia? With COVID, the Dairy Council of Wisconsin started this, and it's nationwide. And if you're a cheese lover, you can join Cheeselandia. And tonight it's going beyond the charcuterie board. But they bring in, it's all through Zoom, so they bring in different cheese makers and talk about cheeses and pairing and,
Ooh,
yeah.
Cheese is fascinating.
Cheeselandia.
And then they let you know when something's coming up, and if you want to sign up for a gift box, they'll send you a cheese the day before.
What?
So, yeah, I've got all kinds
That's
of good
cool.
cheese.
We're all going to that webinar now.
I like it. Just turn it on here.
Right?
See my green watering procedure I had done
The
there?
who?
I had a bunion that was growing up.
Sorry.
So that was the green watering procedure that Dr. Westner did.
Great.
Where they sliced the bone and they slit it and they screwed it.
How long has it been going on?
A couple of years at least.
Got it. Raise this foot up, please. We're gonna take a measurement here. So, anybody who's familiar with measures, if we do a right angle, we're gonna consider that 0 degrees. Yes, I know that's 90 degrees, right? Pull your toes up as far as you can. We're gonna test basic mobility. We would like to see closer to 20 degrees of mobility there. Right now, you're clocking in at about 15. Not horrible. Not ideal. This one's not overly problematic right now, right? Is that correct?
Thank
you. While I'm here, I'm going to assess a couple other things. I'm going to assess how much available motion is in that ankle and foot joint. Just going to stabilize your foot here. Just test this here so you can kind of see the sort of things that I might be doing during a typical assessment. Should be a little feeling of a movement there.
A little bit.
In that joint, adjusting out the flexibility of that joint capsule. You can also test out flexibility of this heel bone on this side with particular attention to how well does that heel twist out. Not horrible, pretty decent.
Oh, okay.
Pretty decent, right? Any remaining symptoms on this foot? I know your right one's more involved.
Yeah, there's a lot of my ankle feels like it wants to pop a lot.
Got it.
Yeah.
Okay. So you said you work as a social worker?
I retired.
Retired, okay. What sort of things do you like doing?
Gardening in summer.
What sort of things would you be involved in right now?
Right now,
For what, for your
not a
ankle?
whole lot. I swim at the Y. I try and go there 5 times a week because that feels good on my back. And just being in the water, I can move a lot more than I can on land.
Got it.
Stretch more, yeah.
Vegetable and flower garden?
Yeah.
Okay. Pull your toes way up towards your head here. Pretty good mobility. Not bad mobility there in the ankle and foot. We'll take a measurement of that. We're about 17 degrees on your left side, close to 20 on this side. You get pain across and through here, and a little bit through here.
If I overuse it, it's on the top of the foot.
What's the mobility feel like on this?
That feels fine.
Does it feel as flexible as the other side or not quite as flexible?
Yeah, it does.
I'm going to back to the camera here for a brief moment. What about there?
That's okay.
Doesn't bother you?
Nope.
It's not as available as the other side. big toe fairly stiff.
Yeah.
Hold your foot down and in. Hold it there, don't let me move it. I'm gonna test the muscles here. Push your foot down and out. Hold it there, don't let me move it. Good. Push your foot up and in. Hold, good. Up and out. Hold, good. Should be paying right in through here.
More toward the outside of the ankle and up. Right there.
It's a bit swollen here. So there's two lower leg bones. The inner larger one's called your tibia, your outer one's called your fibula. There's also a joint here. That joint should have a fair amount of movement. There's some irritation in and around that area. There's a little bit of more stiffness in this ankle joint than this ankle joint. I'm going to treat there a little bit.
Okay.
And we'll determine her symptom response. And this is what I might do in the clinic is, hey, I have something to look at. Let's address it. Let's see if there's immediate change. If there is, we give each other a high five, give her a bill. We then have confirmation that that might be related to it. So we want to do more of that and then perhaps look for other things, right?
Okay.
So I was expecting to see global stiffness, like this ankle's tighter than that one. I did not see that. But this joint capsule seems a little tighter. Now, this is an abbreviated examination, right? I would suspect there's something going on in her hip and ankle, hip and lower back that would need to be addressed as well.
That's what Dr. Jessica has me doing exercises for.
How'd you come to hear about us for your lower back condition?
You did a lunch and learn at the Y.
Yeah.
Mhm. In September.
Massage winner, right?
Yeah.
Yeah.
Wasn't everybody?
No, you were special.
I think there was two of that time.
I believe so.
Was that the one, the first one back? No, it wasn't the first one back after COVID, was it?
No, that was just this fall. Mhm.
So I'm stabilizing that lower bone there, that talus bone, and pulling her lower leg forward and up to get a little bit of stretch through there. You clearly felt that. I'm going to do a little bit of mobilization here. That's a bit looser there now.
Yeah.
This is still stiff. I'm going to give you some quick impulses there. This I'm going to have to do occlude the camera view here. Come on up to standing, please. Take a couple steps. What does that seem like?
Better. Yeah.
Nice.
There's a little clicking in there now.
Clicking, I like that. If it starts to click, as long as it's not painful when it didn't before, and it's combined with her feeling better, that means there's more motion available in that joint. I'm not happy to leave her clicking for a long period of time. It just means that motion is starting to occur. As long as it's not painful. Want to try your mini squat again? What's that like?
Better? Yep.
Lovely.
Yeah.
So that's a component of it, right? Strong component of it. So obviously looking at her, like, does she have a little bit of flat-footedness? Might be, right? So I think certainly
She a little bit of pronation and the.
Yes.
just a little bit.
Yeah.
A lot
I'm
of it.
supposed to be doing
Huh?
A lot of it.
that exercise.
Oh, that's good.
Yeah.
A lot of bit of pronation, right? So she has a very firm pair of orthotics insoles, right? And there's different thoughts about orthotics. We used to, in the physical therapy profession, use fairly firm orthotics. We thought that the orthotics would control and hold the ankle and foot like it should be, right? It doesn't so much. The ankle and foot move a lot. Firm insoles can be helpful in circumstances. They're not well tolerated. Like, you don't like wearing them,
No,
right? So
I had
But I find
orthotics
if I
too,
wear
the waist
them-
of one.
I have good results when I wear them. My feet don't feel as bad.
good. Well, they're helping somewhat, right? But we're using more flexible. We're using kind of semi-flexible plastic that
The
allows.
thing is they take this orthotic, and if you naturally have a flat foot,
toes
and then they throw in a arch all of a sudden on you.
Oh,
way up.
But
Yeah, it's
your
gotta
foot's
be
supposed
toe way up.
Makes sense.
We're gonna do a little bit of work through that big toe as well. Is this bothersome right here?
I can tolerate it.
Not overly comfortable. Of course, that side, you had some surgery then?
Yeah, about 8-10 years ago.
You obviously didn't fuse it.
No.
Not bad, you've been doing a decent job. That's probably 60 degrees. We're gonna twiddle this toe a little bit. So you're gonna feel this. So, all right, so there's obviously multiple things going on, right? So the good thing is she's not afraid of some exercise. She goes to the Y and swims, right? You don't have to go to the Y and swim, but she's willing to do some of that. So we might give her some things to do to help keep that going. So I'd teach her to stretch that calf muscle a little bit differently, perhaps, than she has been. Or maybe she has been, and the stretches she's doing now will be more effective. Might teach her how to loosen that ankle bone up herself, and then she can have a decent chance of keeping some of that flexibility. We're going to want to assess what's going on more deeply in her lower back to get better movement patterns. You're an active gal. I imagine if you were to take an activity watch, you're probably at 8,000 to 10,000 steps a day, probably pretty active. So half of those steps are going to be done by her right leg. So we want the whole leg to be functioning a little bit better. So our focus is kind of where the yowie is, where the pain is, and we'll get some good results there. But as we look up the chain, we're going to probably find better results. Early on, we might bias our treatment towards some hands-on care. Lots of mobilization, lots of stretching. We might be a good candidate for some needles, some dry needling to help calm down pain, right? Early on, we'll do a lot of interventions to drive down pain, to increase flexibility, and then as time goes on, she's going to have more things that she can do.
Can you explain dry needling a little bit?
Sure. Dry needling is the use of acupuncture needles to
Okay.
help reduce pain and inflammation, to allow for people to move better.
But it's not really acupuncture, is it? I mean,
It's not acupuncture. We use the same needles. I'm not an acupuncturist,
uh-huh.
and acupuncturists tend to see things through the eyes of Oriental medicine, which
Right.
has to do with the flow of energy through the body.
Mhm.
Their assessments are quite different.
Okay.
We use needles in common, and a couple of common
So what does
points.
that needle do? I mean, when you...
It helps to produce pain-relieving chemicals, or help the body produce pain-relieving chemicals. It can stretch out joints. It can help calm down nerve patterns.
Okay.
So it can provide some significant relief, right?
Because there's a needle in your body and your brain says, oh, I better send some pain reliever there.
You probably,
And then they attach it to electrodes, which enhances
There's
that.
There's lots of happy
Yeah.
pain relieving chemicals that are released: cannabinoids, opioids, endorphins, and enkephalins. So come up to standing and take a walk.
Wow. Yeah,
Nice.
good.
So congratulations. It's a terrific amount of hope for you.
There's hope yet.
Absolutely.
Okay.
Thank you so much.
Thank you.
So that's a little bit of an example, right? Nothing forceful, nothing that's going to take a long time to recover. Obviously, she's going to need more follow-up care to get to the result that she's looking for, right?
So no surgery?
Well, you can choose to do that if you want, right? Here's the thing, right? I mean, you can always choose to do that. I think it'd be awful if you had surgery and you realized later on that maybe there was something you could have done to potentially either A, prepare for it in a better way, or C, avoid it.
Yeah.
Like, wouldn't it be awful if you had surgery and you realized back like, I didn't need to do that? Like, I can't tell you what my life would be like as having my ankle fused as a young child, right? That would have been a bummer,
Mm-hmm.
right? No, I would have survived. I would have led a life. I wouldn't be doing what I'm doing now physically. I can assure you that.
Well, wouldn't it have caused any stuff like that, and arthritis too, and stuff and everything, from scarring and?
Yeah, I mean, it's going to change that structure, right?
Mm-hmm.
For sure. So, cool. Thank you so much.